Hi, my name's Jasmine Konyek. I've been in the health information management field now for about 20 years. So actually, probably about 25 thinking about it. I've started with health information management. At first, when you start going to school and thinking, ooh, what do I want to be? I started with, I want to, go in the nursing field because I do. My passion is helping people. I really enjoyed that. So I did start truly in the healthcare field, working on a patient floor with patients hand in hand. And I really did enjoy that. That was some of my requisites that I got in my science classes was, to pursue the nursing field. What kind of moved my path just a little bit was kind of a personal event that happened with my family. My stepdad was 80% degree burnt. He got caught on fire, and at this time I'm young, I'm just starting school, and my mom's getting all these bills upon bills of these charges of ambulance and everything that happened. And it really intrigued me because to me, if what is this, what are we getting, didn't we just pay for this lab and that stuff, as I'm trying to help my mom out being at a younger age. So what kind of took me from working with patient care hand in hand, I actually took a position in billing. So when I took that position in billing, I learned about stuff. And what intrigued me too was seeing patient accounts, that were coded. Within the coding, you saw some that were, processed right away, and some patients' accounts were being worked, and it's been over a year. And I was thinking in my head, how can that be? But that challenged me. I like to see that. So that kind of took my shift in gear from working hand on hand into moving into more of that HIM field. So then I, started pursuing coding and billing. Again, I was working with the billing, and I saw the code, so I wanted to learn a little bit more about it. Which again, I just found it intriguing. All these codes that constantly change. I'm like, why does this happen? Or, why do we have all these, back in the day, there was a lot more unspecified, which we still have those type of things with, coding, but not as much as we did. So again, I pursued that. And as I was taking that opportunity, I had a lot of great different jobs that I kind of pursued during then, where in my billing, I really appreciated the job so much that they actually advanced me to be a trainer. And the trainer, I was able to bring it in. We had external collections where we were able to bring that in-house. Then I moved, just due to the position, they had a need, so that they moved the position from the billing area, they moved it to access and registration. So I was really sad to leave the billing area, but I had to go where the position was going. And there I had a great opportunity because I got to learn the front end, where I was training individuals. So I was training nursing staff, ER staff, access, about the medical record in general, about communication with patients, because we have patients that all at times, depending on their cultures, some like eye contact, some don't, just kind of teaching about that. But another benefit that I received was that I really got to understand about is that importance when that patient walks in, getting that information correct. And in the ER, there was multiple times when I'm on the floor training staff, just the registration, how pretty much, yes, that patient was here 2 days ago, but when we did the thorough registration with them, we changed 3 things. So just really making sure that how that information gets in and how it, it really goes from the front to the end to make, a success. During that time too, I then had an opportunity to start with the EMR implementations. So I became a manager of medical records / EMR services, where I was able to assist an organization in bringing them up from paper to electronic medical records. That was great information, for me, and experience in the HIM field of, there's our paper chart. What are we going to do? How are we going to put that that information in. And how is it going to work? Not just from a documentation standpoint of templates for the providers, but the charging aspect. How's those charges going to drop? And how do we get, when you work in healthcare and you see today with all the technology, a lot of things that you hear is what makes the least clicks. So when we're trying to enhance opportunities working in an organization, we tell a provider, well, we have a change now, but you have to do 10 clicks. And before you only had to do 2. Well, doing that on every patient, so working with that within my HIM area, it was a lot of great knowledge that I was able to do. And I helped with the implementations probably, I think it was about 2 years when I did transition into a director of HIM role. And in this opportunity, I got to tell you everything that I learned before from, my again, we didn't necessarily do that registration. You had the front desk do that information. But on the back end for HIM, if the information was incorrect, we did update it at times. So, it was just taking that knowledge and transitioning it into the HIM field with my coding and billing staff, with the medical records, just making sure that everything was aligned. So I thought that, that was an amazing, opportunity to be able to put it all together. And then from that position, where I've been in my current role, is basically I work overall for an organization, and I actually assist with medical records and coding and billing within our electronic systems. So I work closely with legal and compliance and providers and clinical informatics, and making sure that our coding and billing, is up to date. So, January 1st, we're going to have those codes in that are going for CPT and HCPCS, our quarterly updates, making sure that all that information is correct, making sure that our templates meet regulatory. So if a provider is doing an annual wellness visit, making sure that they have the not necessarily the prompts, but, did you ask this question? And that way they have that opportunity to document. With my HIM role, it's a little, I didn't just particularly kind of go in one way. And that's one thing that I do like to tell students or anyone, that HIM, it's more than just coding and billing. It's more than just medical records. HIM, there's so many job opportunities. And when I teach, having them do research on, what job opportunities can you do in HIM? I think their eyes just light up because, in some or professions you have where, this is what I went to school for, this is what I'm doing. But as you can kind of see with my, kind of my job history, all of that, it didn't necessarily start with HIM or, at the beginning, but the majority of it ended. And I know sometimes I go to different colleges where I live and talk, because I'm actually on the health information board for my state. So we'll go to different colleges and we'll talk. And a lot of individuals, what I always giggle out of is, did you go into HIM? Because you might not like that front end, kind of the gory stuff that, you can see gory meaning blood or, that kind of thing. And a lot of them are like, yep, we can handle blood, but we want patient care. Where me, I'm a little bit different. I like being right up front, seeing, everything. But then I also, I like this opportunity too. Where I do have the flexibility in HIM, where I don't have the flexibility if I, did work in the clinical setting of, like my main, I'm able to work from home. So, I can roll out of bed, I can spend time with my family in the morning and not have to get, dressed, for work, to take them to school. And then I can start, doing my 8 to 5 job and, and just that flexibility with little kids, and that I just think is amazing. My typical day, it's not kind of the same thing every day, which I enjoy. Mine is, this is broke, how did it happen? And then I'm working with our IT, I'm making sure, is there anything that wrong? Did something get billed wrong? Did anything happen to that patient's chart? making sure that the integrity of that chart is upheld. So it does vary. Besides, some of my normal reoccurring meetings, a lot of mine is, we have so many platforms that in the organization I work for, is if something comes up, I'm getting on a phone call and working through, just making sure everything is, meeting the expectations of the organization. So that's one thing I do like. And there's some, that may, if you don't have that, or if you want that change so much, with HIM, there are those other jobs, where you do have your coding and billing, where you can pick just one, one specialty you pick for, and you're coding. So you have that consistency. But I think that's another thing I like about HIM is there's so many job positions that are available where you could do something where it's your day is changing, where you don't have that set of knowing what you're going to do each day, kind of like I have, or you have that structure if you want to, which I think is nice. And you have that opportunity of, I kind of want to be challenged a little bit more, in HIM, where you can bring on, like, for instance, for coding, where you can bring on more specialties, depending on your organization, just to give you a little bit more experience, which I think is great. In this field, I really think, I think it's great. I think some individuals, like, truly, when I do go to colleges and advertise HIM, a lot of them still don't really know what it is. So just truly looking at least the job descriptions of what it all encompasses. Because there's some people that may not be interested in one, but there's so many more opportunities. And HIM is just, with electronic medical records, it's evolving. There's more technology, there's more data analysts. I mean, you even have an HIM these days that you didn't previously. So, that's what I would just recommend, is looking at, doing that Google search and looking at the online opportunities, or talking with your advisor of, different, areas that just this field can lead to. But that's where I feel like I was fortunate that I did fall in this field and have all those opportunities, that I currently have been able to do under one degree.